So good afternoon, everyone, and welcome to today's webinar, Declarations of Racism as a Public Health Crisis, Utilizing Declarations to Address Health Inequities, brought to you by the Networks in Public Health Law. I'm Charles Strong, the Senior Digital Marketing Coordinator at the Network's National Office, and I'll be your host for today's webinar. A quick note that both the presentation slides and video playback for this webinar will be available on our website shortly after the conclusion of today's event. We strongly encourage attendee participation and would love to hear from you, so feel free to submit questions at any time during this webinar by using the Q&A tab on the right-hand side of your screen. All you need to do is click on that tab, select all panelists from the drop-down menu, and send us your question. We'll be addressing them during the Q&A portion at the end of today's event. Your moderator for today's webinar is Betsy Lawson. Betsy is a senior staff attorney at the Network's Northern Region office, where she provides legal technical assistance, delivers presentations and lectures, and builds connections in many areas of public health law. Before joining the Network, Betsy spent over a decade working to improve water quality as an attorney with the Midwest Environmental Advocates and the Minnesota Center for Environmental Advocacy. She'll be leading us through the rest of today's webinar, so Betsy, over to you.
Thanks, Charles. Great to have you with us today for this discussion on how to use declarations of racism as a public health crisis to advance health equity. I'm excited to introduce our expert speakers today. So first, we'll start the discussion from hearing with Ukiah Yerby. She's a professor and member of the Center for Health Law Studies at St. Louis University School of Law, and co-founder and executive director of St. Louis University's Institute for Healing Justice and Equity. Using empirical data, her research explores the ways in which discrimination prevents vulnerable communities from attaining equal access to quality health care, resulting in health inequities. Next, we'll hear from Tia Taylor-Williams. She currently serves as the director for the Center for School Health and Education and the Center for Public Health Policy at the American Public Health Association. In this role, Tia provides strategic oversight on projects addressing social factors that influence health, including environment, education, and access to healthcare. Since joining APHA in 2008, Tia has provided leadership in building the organization's capacity to focus more upstream on the root causes of health inequities and advance health and racial equity. Then we'll hear from Zoe Mapofu. Zoe is the Public Health Program Consultant for Buncombe County Health and Human Services, where she leads community health assessment and improvement. Zoe began her career in the office of U.S. Senator John Edwards, and she later served as district liaison for United States Congressman Major R. Owens, leading efforts in affordable housing preservation, youth development, and the implementation of Medicare Part D for Central Brooklyn. And then lastly, we will hear from Dawn Hunter. Dawn is a deputy director with the Network's Southeastern region. Prior to joining the Network, she served in a variety of roles focused on public health policy and health equity. Dawn has worked in state public health at the New Mexico Department of Health, where she started as a Robert Wood Johnson Foundation visiting attorney in public health law through the Network. She also served as Director of Health Equity, Policy Director, and Deputy Cabinet Secretary. So with those brief introductions, I'm going to pass it over to Professor Yerby for her presentation. Thanks.
Thank you. So today I am going to present in part using a report that I co-authored along with my colleagues at the Institute for Healing Justice, Dr. Keon Gilbert, Krista Lewis, and Dr. Kara Banks. This report is available at the website listed below and was released September the 3rd of last year. Next slide. So my presentation is going to build off of that report and work that I am doing with Professor Emily Benfer at Wake Forest, Professor Seema Mohapatra at Indiana University McKinney School of Law, and Lindsay Wiley at American University on health justice. Next slide. Today I am going to talk about systemic racism. Many of the declarations include definitions of racism, but not all. And what is important about the declarations is that they begin to focus and go beyond our traditional notions of anti-discrimination law, which I'll talk a little bit more about later. Then I'm going to move to racism law and the social determinants of health, providing a figure for you to see how these declarations can be used to address health inequities, give you specific cases, and then end with some best practices that are both in the report and that I will discuss in detail. Next slide. Systemic racism refers to a complex array of social structures, interpersonal interactions, and beliefs. It really is about power and about separating groups into hierarchies where one group or many groups are below the group that is in power. Often we think about racism in terms of law and in terms of bad intent. But as we know, we can see racism playing a part in many laws, policies, and practices that are couched in neutral terms. And this was the case also during the Jim Crow era as well. Next slide. There are many forms of systemic racism. I'm going to focus on 3 today. One, structural racism, which refers to the ways laws and policies are written or enforced, which advantage the dominant group, majority group, and disadvantage minorities. And here we're talking about racial and ethnic minorities. Structural racism is often not addressed by the laws. Traditionally, the laws, particularly anti-discrimination laws, civil rights laws, only focus on institutional interpersonal racism. They focus on either neutral policies that have a disproportionate impact on racial and ethnic minorities, or disparate treatment, which is the same as interpersonal racism, where an individual's conscious or unconscious prejudice actually keeps people from having equal access to resources such as healthcare. Next slide. When we think about the social determinants of health framework, it was put in place to highlight social factors outside an individual's control, which could impact their health and well-being. This is a framework that I created and published last year, which actually brings into the social determinants of health framework more clearly how racism, sexism, and other issues have a negative impact on those social factors, and I call them systems. So as you can see here, systemic discrimination, which includes systemic racism, has an impact on law. The way that laws are written, the political process is played out, and that in turn has an impact on the systems that negatively impact and lead to racial inequities in health and well-being. I want to give you some examples so that you can understand how racism impacts these particular systems, and then move on to discuss the declarations and how they can address these problems. Next slide. So when we think about racism, it plays a part in economic stability, particularly on each of the 3 levels. We see under structural racism the failure to provide paid sick leave, workers' compensation, and protections for health and safety to minority workers. And this is a result of laws and policies that were passed during the Jim Crow era and continue today, where racial and ethnic minorities were either left out of collective bargaining opportunities, in which many other workers, white workers, were able to get paid sick leave, or they were expressly left out of the Fair Labor Standards Act, which limits the work week to 40 hours a week. And so you can see how law is used as a way to differentiate the benefits that whites and racial minorities get. And again, this is not necessarily saying that there was bad intent. It can be done in a neutral way. Institutional decisions to use salary history to determine wages. So again, we see this discussion primarily around women, but also racial and ethnic minorities because they tend to be paid less from their first job. And so that follows them as they move up. and interpersonal racism, using race or perceived race to determine pay or promotion. And there's lots of studies on this, including a 2018 study that found that Black job seekers who asked to be paid equally or the same or even more than their white counterparts were actually penalized for asking for equal pay. Next slide. We could see racism playing a part in public health as well, particularly in terms of how we are responding to COVID-19, that we allocate resources in ways that focus it in hospital care. And part of the problem with this is that in predominantly racial and ethnic minority communities, they lack access to hospital care. This is also true based on poverty. Many rural areas have lost their hospitals. And so we see that the allocation of resources may, again, seem neutral, but it's put in a place that leaves racial and ethnic minorities and the poor without access to these resources. We can see this being a problem under institutional racism in terms of neutral mask mandates, where we say we want people to wear masks, but we treat people differently. And so we can see white people sort of being provided with masks, educated by masks, but then policing used to force racial and ethnic minorities who are not with masks and arresting them. And we can even see that in some of the discussion and the protests around wearing masks. And finally, we can see it in interpersonal racism, where there's been a lot of blaming of racial and ethnic minorities for the COVID-19 inequities and deaths and infections, where they're blamed either for the fact that they don't wash their hands, and I'm pulling this from an Ohio senator and physician who said that maybe Blacks and the colored population don't wash their hands, and that's why there are inequities in COVID-19 infections and deaths. And we can see this also in other areas. Former HHS Secretary Azar saying that the Latino culture was the reason for COVID-19 inequities as well. Next slide. So when we think about racism as a public health crisis, here's just a brief list of key racism events in the U.S., dating back to slavery, continuing throughout Jim Crow, and even throughout the COVID-19 pandemic, along with police violence. Many of the declarations that were passed and issued happened after March of last year. So as you can see, only about 6 declarations were made within 1 year, but in a short span of time after the COVID-19 pandemic and George Floyd, we see a majority of those being issued. Next slide. Here, and I'm going to finish up with just some best practices. So even though there were many declarations issued, passed, and one even introduced on the federal level, there were some key points that were not in all of those that could help to serve the community better and actually begin to address some of the systemic racism that I mentioned. And first and foremost is defining racism. As I mentioned, many of the declarations simply say racism, but don't go into detail. And it's so key because at this point, we often only look at interpersonal or institutional racism, not addressing structural racism or systemic racism, which impacts all of our systems. Some good examples where they began to go beyond just our traditional notions of racism are the declarations by Manchester, Connecticut, which included that race had no biological basis and defined racism as a social construct that could include systemic, internalized, and institutional. Also, Durham, North Carolina defines both racism and white supremacy, which gives some support for when you're trying to address it over multiple systems, healthcare, employment, and other areas. I'm going to move on to the next one, using racial equity tools. Next slide. Another best practice to actually being able to address systemic racism is the adoption of racial equity tools. And they are used to integrate an intentional consideration of racial equity into practices, policies, and even processes. I am studying the use of racial equity tools by cities and counties, along with Professor Sydney Watson at St. Louis University Center for Health Law Studies. And we found that approximately 107 cities and counties are using racial equity tools. And many of those that had adopted the racial equity tools prior to 2020 are the ones who were at the forefront of issuing declarations, including Asheville, North Carolina, Ann Arbor, Michigan, Seattle, Washington, and Alameda County. The tools are not only used to begin to think about decision making, but also engaging communities in that decision making process. Next slide. And I am providing you with an example of one from the city of Portland, where you see that they've highlighted their racial equity goals, but also put in the overall strategies that they're going to use a racial equity framework, build an organizational capacity, and that's really key in understanding that community needs to be a part of these decisions, that they need to be empowered to take part in these decisions. Next slide. We also need to think about truth and reconciliation. This is key in terms of moving beyond. You can't address racism if you're not willing to admit what the problem is and how it's harmed people, and then be able to begin to heal from that. And we saw in the Providence, Rhode Island Declaration that they provided and put into practice a truth-telling and reparations process, which is so key. Next slide. Finally, it's important as we move forward, as you're moving forward beyond the declaration, to provide some supports in structural changes. And this really flows from the article I mentioned with Professors Emily Benford, Seema Mohapatra, and Lindsay Wiley, that policymakers can issue the declarations and then they need to take meaningful steps that could be evaluated to see that they're achieving racial equity. One is that it must structurally change the system, provide financial supports and accommodations, and engage and empower communities to take part. And so with that, next slide, I will end by just highlighting a couple of other readings that I think will be helpful if you are thinking about declaring racism as a public health crisis, and then also implementing that declaration. And with that, I'll stop. Thank you.
Great. Hello, everyone. First, I'd like to thank Dawn and the network for inviting ACHA to this timely and necessary conversation. I also want to acknowledge the advocates, scholars, practitioners, and all of those that have been dedicated to dismantling racism for centuries and decades, and just acknowledge all the work that is now coming to fruition. For my talk today, I'm going to provide a framing of racism as a public health crisis. I'll discuss some of the examples of the existing declarations, including briefly touching on what's included and what's missing or could be strengthened, and also review some relevant ACHA resources that you may find helpful in your work. Next slide. So for those of us working in this space, racism as a public health crisis is a no-brainer. However, many others need some convincing, whether it's not acknowledging that racism exists at all, but I think more so is making those connections to health. And while there are clear definitions of what constitutes a public health emergency, a public health crisis is a bit more ambiguous. So I really like this framing by Dr. Sandro Galea and the team at the Boston University School of Public Health, which is that a public health crisis affects large numbers of people, threatens health over the long term, and requires the adoption of large-scale solutions. Next slide. So when we put racism up against this criteria, that it affects a crisis affects large numbers of people, and we think about that the Black and Latinx community alone is estimated over 100 million, and we know that's an underestimate. And we also know that those demographics are growing and shifting, that systemic racism has resulted in concentrated poverty, where 1 in 4 Black Americans and 1 in 6 Latinx Americans live in high poverty neighborhoods, compared to just 1 in 13 of their white counterparts. And then we look at the wealth gap. In 2019, the median wealth for Black and Latinx families was between 24 and 36,000, compared to 188,000 for white families. And this is just to note that these are obviously all pre-COVID numbers, and we know that the pandemic is widening inequities across all indicators. When we look at the second criteria, that a public health crisis threatens health over the long term, because of systemic racism, we have a 5 to 7 year difference in life expectancy by age and ethnicity, have higher rates of chronic diseases among communities of color. We have a maternal mortality rate where Black women are 3 to 4 times more likely to die within a year of childbirth, a rate that is constant even when controlling for socioeconomic status. And then we can look at the COVID-19 pandemic, where Black, Indigenous, and Latinx communities are experiencing mortality and morbidity at rates much higher than their representation of the population. And then the final criteria is requiring the adoption of large-scale solutions. Racism is embedded in our systems and our structures, so the solutions have to be systemic and structural. Focusing on the individual has only widened inequities. Next slide. So it's with this recognition that jurisdictions, as Kaya mentioned, started declaring racism a public health crisis or a public health issue in 2019, and obviously we saw a big surge in 2020. So this slide here is based on APHA's tracking, which we are currently in the process of updating, but we have it at over 170 declarations adopted since 2019. 4 of them have been at the state level, but the majority of the work has been done really at the local level among cities and counties. And these declarations range from governor and mayor executive orders, county executive orders, city and town councils. There are also boards of health and other health entities and school districts that are making these declarations. Next slide. I know that Dawn is going to go into more detail about the language of some of the declarations, but I just wanted to take a moment to highlight some of the commonalities across the declarations that we've examined. And one of them is around this acknowledgment of racism. Like Rakaya talked a lot about the definitions, and that's a key piece. And it's also acknowledging that racism is racism and not race that is the driver for unequal outcomes. And that's an important distinction. We know that the reason that Black, Indigenous, and Latinx people are dying at higher rates from COVID is not because of their race. It's because of the differential treatment and lack of access to resources and services due to the insidious ways that racism permeates our systems, all of our systems, from healthcare to housing to education and beyond. So on this slide, you just see an excerpt from the Boston Declaration that racism is a threat to public health and safety and is a paramount social determinant of health, shaping access to the resources that create opportunities for health, including public safety, housing, education, and employment, and is a persistent barrier to health equity for all Bostonians. Next slide. Many of the declarations also acknowledge the historical foundations of racist policies that are embedded in our system, acknowledging the intentional ways that disadvantage was baked into U.S. government policy and still permeates our institutions and our systems. The Michigan governor's executive order acknowledges that racism has existed in America for over 400 years, from the genocide of indigenous peoples upon the arrival of the Europeans, to chattel slavery beginning in the 1600s, to the Jim Crow era. It goes on to say that historical racism in Michigan has affected people of color who reside in the state. For example, discriminatory housing practices in the 20th century, such as redlining and exclusionary housing covenants, contributed to segregation and created an obstacle to the transfer of generational wealth. Next slide. From what we've seen since we started tracking these declarations is that there's definitely a spectrum. Some are more robust than others. But we're also noticing a few commonalities across them. And I know Don is going to go into more detail on this, so I'll just stay kind of high level. Data and accountability is one of the key areas. And this includes the creation of an office or group for the purpose of data collection on racial inequities in the community. It might also include the creation of a group to ensure accountability on any stated equity goals, whether that's in the actual declaration or as a part of a broader city, county, or state plan. So a few examples, in San Bernardino County, California, they created an equity element group to identify policies and programs to address the impact of racism. Holyoke, Massachusetts established a Citizens Police Advisory Committee with the power to request information from the police department and inform them in providing recommendations to their mayor. Community engagement is a key piece of advancing racial equity and justice, and some of the declarations have really strong provisions around that. One example, and they commit to forming and strengthening partnerships with community groups and organizations that are aimed at improving the health of communities of color. In DeKalb County, they promote joint racial equity training for community partners, grantees, and vendors and contractors, along with government agencies. Next slide. The declarations also include some specific actions around racial equity specific programs, which includes promoting an equity in all policies approach. And that's where many of the frameworks that Rakaya was mentioning can really come into place. Many localities are already using those tools as a part of applying an equity lens to their decision making. Minneapolis, the Minneapolis Declaration charges them to evaluate the city charter as well as all city policies and procedures to prioritize racial equity. And in Allegheny County, Pennsylvania, they're advocating for policies that improve the health of communities, including the Black Mamas Matter policy agenda. And last but not least, funding is a key piece, right? Much of this cannot be done without funding and other resources. And while the declarations may not be the place to add specific policy provisions, some of the declarations have been accompanied by specific policy asks. For example, in Boston, an accompaniment to their declaration redirects $12 million from police overtime funds to equity inclusion efforts, for including funds for the Boston Public Health Commission. And in Minneapolis, their declaration allocates dollars in the mayor's budget to be directed towards small business development, housing, community-based infrastructure, and other amenities. And it also includes the creation of a sustainable funding stream for youth development. Next slide. So a few things that are missing or not as prominent across many of the declarations that I just wanted to highlight. As Rakaya mentioned, having a justice framework is incredibly important. And specifically, one of the things that we noticed was missing from some of the declarations is a more explicit focus on building civic, cultural, and political power among impacted groups. A more of a focus on racial healing. I think Rakaya touched on this. Is, some of the declarations include actions around training, but we really like to see more explicit language around promoting healing in communities. We will not make meaningful progress towards equity if we don't address the deep division and trauma that exists within and between communities. More specifics around cross-sectoral collaboration and the agencies that need to be involved in this work. I think many of the declarations are pretty vague about this. And then obviously funding and resource allocation. This work cannot be done without the resources. Next slide. So now I'm going to briefly go through a few APHA resources. As many of you know, APHA has been tracking these declarations, and we've got a website, which I'll put the URL in the chat. Our website is pretty up to date, although we've had a bit of a content freeze, and we'll be making some updates very soon. Next slide. But I'm excited to announce that we have taken those declarations and created a mapping tool that we will be launching very soon. I don't have an exact date, but we're aiming for early February. And here's a zoomed out version of the map. It's of the 48 contiguous states. Currently, Hawaii and Alaska, they don't have declarations, but they will appear on this landing page once they do. And you can obviously zoom out to see them if you wanted to. Next slide. As you zoom in, the points are more visible. When you click on a state, the geographic points of the declaring entities are visible. You can see the number of total declarations within a state and a list of the declaring entities and a link to the resolution. I forgot to highlight at the top of the map, you'll be able to see the different levels, and you'll be able to see and sort the different levels, whether that's, you want to see all the declarations, the ones at the city, state, or county level. I should also point out that the color gradation indicates where where the declarations are a bit more concentrated. You'll also be able to see the different types of entities making these declarations, whether it's a health entity, you've got a board of health or a public health association, a city or town council. We're also starting to track those declarations made through education entities. Next slide. I will put my email in the chat as well. You'll also, I believe, get a copy of these slides if anyone would like to be added to our mailing list to be notified when this map is available. But the URL that I will share is the same URL where the map will be posted when it does go live. Next slide. I also wanted to point out our book, Racism, Science, and Tools for the Public Health Professional. This is an incredible resource, and you can also earn up to 15 continuing education credits. I don't know that we offer CLE directly, but often you can apply those. You can get you can complete a specific form and see if that qualifies for your accrediting body. And lastly, this is more broadly around a tool for racial equity. In the summer of 2020, we launched a 6-part webinar series focused on racism as a driving force for the social determinants. Next slide. And all of those webinars are available. The recordings are at this URL, apha.org/racial-equity. The topics for those webinars range from reproductive justice to policing, racial healing, housing, and environmental justice. Next slide. And we also have a discussion guide that accompanies that resource that includes reflections and discussion questions, different types of activities and exercises that you can walk through either as an individual or in a small group, and a list of resources related to the topic. The part one of the series focuses on webinars 1 through 3, and we will be launching part 2 next month. Next slide. So thank you all so much, and I look forward to the conversation. I'll be sharing some resources in the chat, and I will hand it over to the next speaker. Thank you.
Thanks so much, Tia, and thanks for all the participants who are joining this conversation. Wanted to make an acknowledgement before I share some of the ways in which we're using community health improvement to build a chorus of equity-based messaging and action to eventually lead us to this place where we have this new policy instrument. I come to you today from Asheville, North Carolina. However, I think it's important to acknowledge with respect that the land that is Asheville, North Carolina, in the county of Buncombe, are the ancestral lands of the Anatikiwaji, whom we all commonly know as the Eastern Band of Cherokee. And it is these lands, the Tagayashki, that I'm able to present a little bit of our journey and the road that we have going forward. Next slide, please. And here you are, being able to see a visual representation of our community and the Tagayashki, the interpretation, where they run. And in these lands, buffalo used to gather during the annual fall for feeding. And so we continue to have a lot of that environmental gifts and abundance with a very rich, deep ecosystem. And that also manifests very much so in our economy. Next slide, please. As you're looking, the land of sky, Buncombe County, and this is our downtown. We're so well resourced, rich in culture, rich in tourism, and obviously very much a robust and fertile environment. Unfortunately, that abundance does not necessarily manifest when it comes to our health outcomes. Buncombe County is continually top ranking in terms of our ratios for clinical providers. We continue to be at first, whether it's for rankings in the best place to live or unemployment, of course, prior to the COVID pandemic. In 2014, our community had the honor of being recognized by the Robert Wood Johnson as a Culture of Health Prize winner. And at that time, we settled on focusing on access to healthcare, building and ensuring health behaviors, particularly around healthy eating, and then working towards other kind of health and behavioral prevention strategies. Unfortunately, when you kind of lift up the hood on all of these measures, you can see all of those racial and ethnic disparities. Some of the most consistent are around the disparity in terms of length in life, and also around mental health and infant mortality. Here in Buncombe County, Black babies are more likely to die within their first year of life at 3.8 times that of white babies. And it happens to be one of the health-focused conditions for our 2018 to 2021 Community Health Improvement Plan. Next slide, please. And so before we were able to receive our declaration, we've been engaging with many of our community partners through 3 really important systems change approaches. Those include collective impact, results-based accountability, and developmental evaluation. Very quickly, what collective impact has helped us really position this work is specifically around movement building. There's so many ways in which in the past we've been approaching a lot of our community health improvement, whether it's all of the work that we want to do upstream to downstream in a problem management place. And so we've really repositioned ourselves also not to just be a backbone, that is our community health improvement, but really a container for change. Through being able to really see our work within collective impact as a movement, we've really been able to leverage all of the relationships and all of the pre-existing and self-organized entities to be a part of that transformational change in health disparities. And also to measure our work, to define those strategies, to ensure that they very much are community informed, and that we're always also not only just capturing what's happening at the community level, but what's happening inside agencies, inside institutions, at that performance level. We're using results-based accountability. And results-based accountability works very well for equity, and is the approach that the Government Alliance for Racial Equity, or GARE, has also been using as a way for communities, municipalities, and other jurisdictions to not only plan, but also to measure their equity work, particularly around health. Results-based accountability is something that is very attuned actually for working with community. And some of the three questions it asks are: how much are we doing? How well are we doing? And is anyone better off? Now, with all of this work in systems, in transformation, there's always going to be VUCA. VUCA is a military term. There is a volatility, there's uncertainty, there is complexity, and there's always ambiguity. And so where developmental evaluation is of great value here is that we're always looking at the, rather than going from a linear or a logic model, it really allows for us to harness what is the emerging and all of those nuances that you may not have been able to see had you been working kind of in a linear mindset. Yes, logic models do have value. However, when it comes to systems transformation, it's never going to go in a straight line. Next slide, please. So key pieces to our work, we've got a various and growing and ever-evolving toolbox. When thinking of how do we communicate, how are we telling the story, how are we making sure that folks know about the opportunities to engage and come to the table, we're using gamification, and we're using Policy Link, and their equity index is a really great tool should you be one of the communities that have data available on their site. And then we're also helping our key stakeholders be able to tell the story. In terms of gamification, prior to the pandemic, we would quite often in convening create data placemats that apply the numbers, the local numbers, as well as some of the innovations. Really great when thinking of engaging communities in houses of faith, engaging communities who may not necessarily have a high level of data acumen or capacity to see the numbers, but in a way that is kind of kitchen table ready. We've also used a lot of our local farm team stadium, and during the summer of 2018, we engaged the community in asking them what matters most to your health, and they were able to see their answers on the Jumbotron. This just really made the work that we're doing in public health tangible, relatable, and fun for all of our community. And in terms of the equity elevator, we're using the 2793 rule. So you've got all of this data, and you've got local leaders and other stakeholders who may not be immersed in it every day. 2793 allows, we've created elevator speeches on all of those core health equity priorities. So in 27 words or less, delivered in 9 seconds, you deliver 3 points. This is really an important key in terms of disseminating the message and the priorities in order to be able to achieve some of those policy outcomes that we're looking for around health disparities. We're also using the pair of ACEs model. This is from Wendy Ellis and Richard Dietz out of the George Washington University. Targeted Universalism out of Berkeley and the Center for Othering and Belonging. And that has been really instrumental in terms of us repositioning our work from the transactional to the transformative. That has so much value as it's been an important tool for us to really engage community and how they can be part of reclaiming government so that it serves people, building those places for public debate, influence, and service. And also, it's been very important in even engaging the community in terms of how they can re-envision our economy. Next slide, please. So we were fortunate that in the summer months of 2020, our community made great gains in terms of these policy instruments that not only named, but also allowed some accountability towards how we will make some changes in our local governance around health inequities and to move towards eliminating racism as a factor in health outcomes. Where we got in June 26th, when the Buncombe County Health and Human Services Board declared racism a public health as well as a public safety crisis, was the culmination of all of this movement building, informed by collective impact, informed by developmental evaluation, and all of the ways in which we were really supporting our leadership and then also bringing community to the table to be part of the storytelling. And it was all really catalytic in this policy moment. The city of Asheville was also historical in terms of being the first municipality in the Southeast to have a declaration of reparations, and that was on July 4th. And so Bastille Day has a new meaning for us here in the region. And then following up on August 4th, the county commissioners also passed resolutions naming public health and racism a public health and public safety crisis, and then also going further and also signing a countywide resolution on community reparations. Next slide, please. There's much for us to do. In all of our instruments, though, in the therefore statements for our public health crisis statements and also for the reparations, we do have there named some commitments for action. And since then, our Buncombe County Equity and Inclusion Work Group has started the draft of an equity action plan. Two major components that we have are around our community goals as well as our foundational. So starting with the foundational, those are all of the measures that will be happening within the Buncombe County workforce. We are nascent in terms of articulating this, and so there's lots more iterations, but in this early place, we are making sure that we're ensuring that our workforce is equity ready. And then at the community level, we're making sure that there are clear and concrete pathways that are inclusive and really speaks to belonging as a culture as we codify this equity action plan for implementation. Next slide, please. And so finally, throughout all of this, we've learned so much, and learning that it's really got to be about systems transformation. Throughout all of this, we've really repositioned how we plan, how we implement, and how we evaluate our work. What's very key is that in all of this planning, to really understand and acknowledge that community can often be in a place of data fatigue and feel as though they are being overly extracted. And so we're very sensitive to that and understanding that there can be a kind of extraction and engagement tax that is put on people of color whenever you are working to achieve this policy milestone. And then in our implementation, we know that we can't be in a place where at time of creating this document is when we might want to bring communities of color to the table, but really we have to continually invest in authentic proximity and connection before content is a new way that we are approaching our culture of equity and inclusion. And then also in evaluation, we started with it, disaggregation. It's yet to be seen what this most recent census will bring up in our ability to disaggregate data. And then we're also using asset-based language when we do talk about those disparities, as we know that these disparities, while they can be truths, how we present them can also be really important, as we don't want our data stories to also serve as a position of othering as has happened with some of the aspects of the pandemic. So look forward to our Q&A section. And with that, I'm going to pass on the rest of our presentation to Dawn.
Great. Thank you, Zoe, and thanks to Rakaya and Tia. The presentations so far have just been wonderful and have had so much great information. Next slide. I am not going to take too much of your time. I'm just going to talk very briefly about our work here at the network and looking at local, state, and federal actions to address systemic racism. And I'll also highlight some specific tools, strategies, and examples that you may be able to use in your own work. Next slide. First, I'm going to cover state and federal actions. So resolutions in state legislatures are, for the most part, very similar to those at the local level, in that they're statements of legislative intent, but they do not carry the force of law behind them. But as you've heard, resolutions have value and that they clearly signify the intent of the issuing body to address an important current issue, and they can help steer future discussions about more concrete actions to advance the goal of addressing racism. And I'm not going to go into all of these examples listed here. You will have these slides available to you afterward. But I will note that 24 states have or had a work group or task force to address COVID-19 health disparities, and more than the 12 cities or counties here, but I looked at 12 of them, that also tried to specifically address COVID-19 health disparities. Next slide. And I'm going to go into a little bit more detail about that. So I've worked with Betsy, our moderator, on analyzing these COVID-19 health equity task forces and any reports or recommendations that have been issued. The green states here established a task force in response to COVID-19, and the 3 teal states, I'll call them teal, use existing infrastructure through either the Department of Health or the governor's office to take action in response to COVID-19 disparities. And I'll also note that while most of these task forces had a broad mandate, there were a handful, like New York, that focused specifically on birth equity, and Idaho that focused specifically on testing. But most of these task forces have completed their work. Some of them are still meeting, and there is an intent for these groups to continue beyond the pandemic and to become a permanent part of agency infrastructure. I include this here because there is a significant overlap in the recommendations issued by these task forces and commitments to address racism as a public health crisis. Overlapping items include equitable data practices, community engagement and inclusion, improved and inclusive communication strategies, improved healthcare access, measures to address the social determinants of health, and strategies to support implementation, like using racial equity tools, which we've heard about already, and creating a permanent office or entity to continue racial equity work. It's really important going forward that these are not disjointed or disconnected efforts, especially since, as you will see in a couple of slides, there is significant overlap with the jurisdictions that have declared racism a public health crisis. And these are largely concentrated in the Midwest and the Northeast. Next slide. So if you know me, you know I love a legislative session, and state legislatures are beginning their sessions. And this slide is just looking at bills that have been introduced in January, although some of them may have been pre-filed. There are 47 state and territorial legislatures that are now in session, and I will be following and monitoring legislation that addresses health and racial equity as these sessions progress. And I just want to highlight a couple of examples. So Tennessee, Virginia, Indiana, Connecticut, and Missouri all have bills or resolutions declaring racism a public health crisis. The bills in Indiana and Connecticut would establish a task force or commission to examine the impact of institutional racism on public health. New Mexico, Illinois, Oregon, Washington, and Kentucky all have bills related to educational inequities. New York would actually require the Department of Health to collect and report data, including racial, ethnic, and other demographic disparities due to COVID-19. And this is significant because New York is currently only reporting race and ethnicity data for COVID-19 mortality, while other states also report demographic data for cases, hospitalizations, testing, and other measures. And then I want to highlight 2 other examples. A number of states have introduced bills establishing continuing education or other training requirements for healthcare professionals, specifically Washington, South Carolina, and Nebraska. Now, this is noteworthy because the vast majority of states, surprise, do not actually require cultural competency training, continuing education for healthcare providers. So, if you're thinking about where's the place to start, one good place to start is revisiting licensing board regulations and those requirements. Oregon's the other example I want to highlight. The Oregon executive team issued a health equity framework, and a number of bills that we've seen there so far are aligned with that framework. This includes establishing a regional health equity coalition model, requiring that rulemaking address the effect of a rule on racial equity, and ensuring training for groups and agencies that interact with persons who have experienced trauma. Next slide. So there was also some federal legislation in 2020, which we're not surprised didn't go anywhere, but I also am not going to spend a lot of time on these, but I will note that just like at the local and state level, simple federal resolutions in general are statements of legislative intent, and they also do not have the force of law behind them. I will highlight the Anti-Racism and Public Health Act of 2020 that would have, among other things, created a National Center for Anti-Racism at the CDC and supported research and development of interventions to dismantle mechanisms of racism, including evaluating policies and practices. It would have also created regional centers of excellence and a data clearinghouse. So there was definitely a lot of attention given to, what steps could be taken to create the infrastructure at the federal level. Next slide. So what will the movement to address racial equity look like in the Biden administration? I cannot emphasize enough the significance of racial equity being a core part of the administration's plans in terms of giving attention and resources and support to efforts to address the longstanding effects of racism on our society. As you can see on this slide, the administration has issued a number of plans that are specific to different population groups and social determinants issues that impact racial and ethnic minorities in this country to a greater degree, like housing and economic security. So we already know, and we have seen in the last 2 days, that a lot will be accomplished by executive action, and we see that in the agenda that's been released by the administration for the next week. But, really change also comes in incorporating DEI principles, diversity, equity, and inclusion principles into the operations of federal agencies, as well as all of the agencies that you all work for. It's not clear how aggressive a legislative agenda might be or how successful or how far it might make it, but certainly changing operational policies and practices is a significant step. We saw actually already one of the executive orders that's been signed is going to help toward implementing DEI in federal agencies, and that directs every federal agency to review its state of racial equity and to deliver an action plan within 200 days to address any disparities in policies and programs. And it also directs the Office of Management and Budget to allocate more federal resources to underserved communities. So that's just an example of federal action. Next slide. So I'm not going to go into great detail here, but just to recap, we have over 180 declarations of some sort that have been issued or adopted. For our purposes here as a network, we are analyzing state and local government entities like city councils, county commissions, boards of health, and school boards. We released an issue brief in June 2020 to critically assess the language in some of the first declarations issued. Next slide. We're currently updating that analysis from June 2020, and we are starting with the Southeastern region, which is in green here, and looking by region at all of the declarations that have been issued. And so this is our network's regional offices. The Mid-States region in purple has the most, with Ohio leading the way in terms of the number of jurisdictions that have issued declarations. Next slide. So in our analysis, there are a lot of commonalities, and that's because there are some great templates and tools out there for agencies or organizations looking to issue a declaration or resolution. For example, Salute America has a toolkit available on their website. But all of these declarations have some combination of the following: a clear declaration linking racism to be a public health crisis or emergency, and you heard Tia explain why some of that's important. Measures relating to organizational policy or practice, like hiring practices, an emphasis on partnerships or collaboration, and often with reference to specific agencies or organizations or to communities of color. Accountability measures like plans, goals, and timelines. We heard Zoe give some examples of that. Focus on a specific issue like adverse childhood experiences, and a call to action to other leaders. And then more recently, we've broken out infrastructure from accountability to recognize when commitments have been made related to establishing a new office, a new position, or funding for racial equity. Next slide. So this slide has examples of some of the specific actions recommended across these declarations. Tia and Zoe have covered some of those, so I'm not going to go into a lot of detail. You will have these available to you. But common recommended actions are related to actionable data, developing racial equity plans, assessing policies and procedures using a racial equity tool, on everything from hiring to promotions to leadership appointments, vendor selection, grant management, and budget allocation or other funding decisions. And the role of community is arguably the most important piece because communities most impacted have to be the ones to identify and to lead the solution. Next slide. So I'm going to spend the rest of my time just giving you a couple of examples of other racial equity tools that are out there. And there are a number of great ones, and we'll make them available to you, and you'll have links and references as you'll see on the next slide. So just jump to the next slide, please. I'm going to start by pointing out that there are a number of laws and policies that you can look at. These are just a handful of examples here. Two important examples that are not on the screen, but that I would highlight are workforce diversity, so looking at your hiring, retention, and promotion practices, as well as language, literacy, and accessibility policies and practices. And I just want to also emphasize that as an organization, you might assess things that you do or policies, or laws that you maintain, but you can also assist and guide others in this process. Next slide. So on the left is an example from King County, Washington, that I included, their equity impact review process. And I like what's in the middle, guided by community priorities and informed by current equity conditions. They also incorporate continuous quality improvement, which is a necessary component to this work. On the right is an example that I worked on for the network. It is a tool for evaluating public health laws and policies. It can assist in identifying issues in the drafting, design, or implementation of a law or policy that could have a disproportionate impact. And the framework also asks you to consider other ways that you might achieve your intended outcome. Is a law even necessary? Maybe you need a regulation. Do you need a memo from your general counsel? Or maybe it's just a formal statement from your secretary or commissioner of health. So the framework also includes a step related to continuous quality improvement and emphasizes engaging the community. Next slide. I like the Moving to Institutional Equity tool put out by the National Association of Chronic Disease Directors. It has guidance and worksheets for all steps of the process to evaluate institutional practices. And I especially like they have an equity cross-check and a key informant check. You should absolutely circle back and ask if your action plan will meaningfully advance health and racial equity, and whether experts, including and especially community experts, think that your plan is sound. And finally, on the right is an excerpt from the APHA Advancing Racial Equity Discussion Guide. So if you get a chance to check out the webinars you just heard about, this is the accompanying guide to go with it. So it also gets at questions of diversity in decision-making, who is most impacted, and whether there is a system of accountability. Next slide. This is the last example, and then I promise you we're about to get to the Q&A section. So this example was just released in December of 2020, and there was a webinar within the last week or so to introduce this tool. It's an equity lens tool for health departments. You'll note that many of the core questions are very similar to the other tools. Who is the decision maker? How did you involve the community? How will you communicate the decision? The takeaway message here is that there are a lot of tools out there, and you should use them in any combination or way that works for you and your organization. There's not one right way to do this, but you should see common threads in the examples that I've provided. Next slide. So this is my last slide. You issued a declaration. Now what? So the takeaway message is that, one, there's a lot that can be done. And declaring racism a public health crisis or an emergency is an important first step. Now is really the time to act while there's support, while there's momentum, and before there's a change in administration, whether that's at the city, county, or state level. You know, the same counselors who approve the resolution could be out in 1 or 2 years, and you could have new counselors come in who don't have the same priorities. So act on it now. I also want to highlight 2 things on this list very quickly. Evaluate and then change policies, practices, or laws to advance racial equity. And then you need to actually monitor implementation to see how things work in practice. And then continue to evaluate and make changes as necessary or appropriate. The other thing I would highlight is to use tools or other resources and to systematize their use. For example, by including them in job descriptions and in performance evaluations. You have to make this just a part of how you operate as an organization. And I think the bottom line is that these declarations are a starting point that lays the groundwork for the process to achieve racial equity. And it is up to everyone who is impacted, to all of us, to create a sustainable infrastructure, to operationalize and normalize new ways of acting and being, and to create ways to be accountable for progress. So I'm really excited and looking forward to the Q&A section. I'm going to turn it back over to Betsy to start us off.
Well, thank you to all of our presenters for those really informative and interesting presentations. So we are going to start the Q&A session now, and we encourage you to send any questions you have using the Q&A panel on the right side of your screen, and you can select all panelists, type in your question, and we will get those questions asked to the panelists in just a moment. First, wanted to start off the panel Q&A discussion with a few central issues that are related to declarations of racism as a public health crisis. So to start the discussion, Lakaya, could you share your thoughts on how the health justice framework fits together with the health in all policies framework?
Yes, thank you. So one of the ways that we see the health justice framework fitting together is by actually incorporating community empowerment and not just thinking about how health affects all policies, but also empowering community to be a part of that discussion. Furthermore, when we think about health in all policies, it is just the beginning step to begin to determine how employment, how impact health. And what we're saying is that as you do that, you also need to change the systems and structures that have led to those problems. And finally, that we must provide financial, material, and other supports necessary to overcome those. And so I think in our presentations today, definitely Tia mentioned in Boston how they were shifting money and providing money for housing, economic development in those communities. And so that's really the key, that as we're moving beyond just the evaluation process of health in all policies, that we make substantial steps to including and empowering community, providing supports, and changing the systems and the structures that have led us to racial inequities.
So thank you. Are any of the other panelists want to take a moment to weigh in on their thoughts on that question as well? All right, then I can move along to the next question here. So we were hoping that the panel could address how to respond to those that are skeptical about the necessity or the utility of these declarations. Tia, do you want to start off that discussion for us, please?
Sure. As Don was mentioning, these declarations are really an important first step. It really focuses on systems and structures rather than dismissing, inequities as the fault of individuals. But we also know that these declarations have to be accompanied by resources and should include, ways to hold governmental systems accountable for making meaningful progress towards equity for people of color. But I also don't want to dismiss the symbolism. We really need to acknowledge that there is significance in that symbolism, because for a really long time, the United States has ignored and even, diminished the existence of racism. We've skirted around using the word. In the health community, for truth telling, we focus on the so-called biology of race as a driver for health disparities and inequities. So with these declarations, jurisdictions are making a public and historic acknowledgement that not only does racism exist, but that it's a major driver of health outcomes. I don't know how many people saw this, but recently RWJF released series of polling results, and they found that many people, including those that are hardest hit by the pandemic and longstanding inequity, still don't see systemic racism as a barrier to good health. So these declarations can be used to highlight those connections, stress the urgency of why it needs to be addressed now, and also support that truth telling that's needed for a true transformation.
T, I think you bring up a really great point in terms of highlighting the truth telling. And so what I'm reminded of is the process that, many of us have, maybe heard a little bit about the truth and reconciliation process that came out of South Africa following, apartheid. There is Harriet Washington's book, Medical Apartheid. So in thinking of why do this, it is a very important cognitive and then also symbolic, but also a unifying instrument and strategy for us to really have an instrument that does lay out the medical apartheid here in the United States before we can really authentically move in a transformative way to the reconciliation component, which is all of these strategies and programs that we are thinking of and the ways in which we want to engage community.
Thank you. Are any other panelists wanting to weigh in before we move on to the next question? Those are really great responses. Okay, we'll move on to the next question. And Don, this is one that I think you might want to respond, get the discussion started on. What are some meaningful ways that health departments can engage the community?
Yeah, I hope other people also have some ideas about this, but I would give two examples. So the first is the SHA or CHA and your SHIP or CHIP process. Everyone does a great job of saying, we're getting community feedback, we're doing community surveys, and we're going to incorporate that information to our plan, and then nothing else really happens in those communities, where there isn't really meaningful progress or it's not communicated back to those communities. So I would say that one process change is actually take your SHA or your SHIP or similar plans back to communities and ask them if you're doing a good job. And if you're not, you need to work with communities to identify where you can make adjustments. So there has to be a constant feedback loop and an opportunity for community to give feedback into whether or not community priorities are being addressed. The other thing I would say is a lot of health departments and even other government agencies have advisory boards and councils. They're administratively attached to the agency. Agency staff provide administrative support, but often what that means is that that agency drives the agenda and drives the conversation. And I would challenge you to think about having those advisory boards and councils actually drive their own agenda. I mean, their job is to advise you from their perspective as experts in the community, not the other way around. And so really think about how those boards are structured, how the agendas are developed, how that feedback influences decisions that are made for your programs. And then again, be transparent and communicate back to the advisory board why you did or did not follow what they recommended. So those are two, I think, important examples, particularly for health departments.
And I would just also add, similarly to what Don said, is that there are, existing health and all policies efforts where community engagement is supposed to be a key component of that. And I think the implementation of health and all policies at whether it's the state or the local level is mixed in terms of their community engagement. So I think, whether or not you have one of these, you have a declaration adopted, I think those are some other opportunities to really look at to what extent you really are providing opportunities for meaningful engagement from the community. And that also includes, the possibility of, your priorities not being aligned with the communities and really taking a look at how you can better represent what the community's priorities are within your health and all policies.
And one of the ways in which we are really allowing, engaging community is we've made a commitment, and this is also, in the spirit of collective impact, that, states nothing, nothing for us without us, right? Nothing about us without us. And so we've really decided that we will no longer take part in any RFPs or in any grants that require an intervention that the community has not endorsed as a evidence-based or practice-informed strategy that they're not necessarily ready to receive. And so in thinking of this is the people's house, our local health department is something that has to absolutely, in thinking of all, when thinking of class, right, it has to be not only racially, but, culturally aligned. And so we're using all of these kind of funding opportunities or program opportunities to make sure that our community also gets to be part of that blueprint and in co-design and architects of what health improvement looks like.
Right. Thank you for those great responses to those questions. I am looking at the Q&A in the chat, and there are so many great questions coming in from the audience. And I don't know that we'll have time to get to all of those questions, but I want the audience to know that we will record them and try to respond to them individually if we don't have an opportunity for the panelists to respond during the next 15 minutes that we have left. But such great questions. And I'll just start going through a few, and they're generalized questions mostly, so panelists should feel free to share their expertise on any question that comes in here. The first question is, does anyone have recommendations for how stakeholders can hold government accountable for stated health equity efforts? So the example that was provided in this question is CDC's COVID vaccination guidance, and most jurisdictional COVID vaccination plans mention health equity without action to address.
I'll start because I believe the importance of our role as constituents to contact our legislators. I hope everyone does that. You might get a form response back, which has been my experience, but you still get a response. But I would say contact them. I mean, contact your health department, contact your city council, your county commission, and ask them, what are they doing? What action steps are they taking? And ask them to make that information public. I just saw a report today about a community where real estate agents and bank employees were going to get vaccinated over the upcoming weekends, and a local newspaper got wind of it and started asking questions. And so now that it's off, why? That group is not in one of the first groups that is prioritized for the vaccine. So I think it's important to draw attention to the people who can kind of help to ask questions and to shine a spotlight on where things like that, where like vaccine distribution is inequitable. The other thing I would say, as agencies and organizations, is that you have a responsibility to be transparent and to set goals and to publicly communicate how you're reaching those goals. And if you're not doing that, you need to find a way to put those processes in place.
I would just add, I think it's not only holding them accountable, but offering a different plan. And so I know communities, churches, community groups have worked together to try to provide support for their communities to get access to the vaccine. So I think oftentimes it's not just holding them accountable, but also offering them a plan that could be used to actually attain health equity and get out the vaccines to people who need it the most, who are in vulnerable communities. I think that will also help in the uptake because if you're coming from the community with a plan and working with them, then people are more likely actually to get the vaccine as well.
Yeah, you've heard data a lot during the presentation today, and I think that's really important. Especially as a community member, being able to say, here's the impact on my community, and here's why we need to be doing things differently. I think that's really important. That both agencies are making those data available, but that also that we as community try to use those to help advocate on behalf of our friends and families and neighbors.
Great, thank you for those answers. Does anyone, are there any other answers to that question that you want to provide right now, or? Nope, okay. This is a question specifically for Zoe, but I'm sure all of the panelists would have responses as well. But Zoe, how are declarations that specifically call for reparations different than other reforms? And how are declarations defining reparations?
It is, we do not have the time to necessarily go into it here. And I will say we are quite early and we haven't been able to get to a place of the material component of it. And so we really have just been in the naming place. And I'll yield to colleagues on the webinar to maybe provide a much more robust answer.
I can jump in and just say, to me, what reparations represent is the acknowledgement that it's just not symbolic, and that these practices have led to historical and generational harm. And so whatever actions we do will be long-term, and there also needs to be a commitment of not only the symbolic declaration, but changing the systems, and then also providing support for people who need it in multiple ways. And so what I'm excited about is that even if the words reparations are not used, sometimes you get the same meaning. So when we look at in Boston, where there was a shift and money away from the policing budget to housing, development, and generational wealth, that to me is the beginning of the discussion about reparations. And I just want to be clear too, is that it's a shift from our view that all of this harm ended with slavery, that it's continued over Jim Crow, as was mentioned, I think, by Zoe and Tia, that it's continued throughout our structures. And so it's something that we're going to have to wrestle with and build capacity for those people who have been left behind for generation upon generation.
And I would just add to echo Rakaya's comment about in some cases, reparation isn't explicitly mentioned, but there may be reference to some type of equity package or the creation of a group and resources for focusing on, community wealth building. So I think it can take many different forms, and that's something that we're really looking to do a deeper dive on the declarations to see to what extent they include those resource allocations, because I do think that it can take a number of different forms.
It can take a number of different forms, and I'd say a very early example, as we really have yet to have our community articulate what that looks like. One immediate remedy that the city of Asheville has taken is a moratorium on sales that are under the stewardship of the city that were acquired as a result of urban renewal. So in thinking of it, all of those homes, all of those tracts that the city may have oversight for now, we've put the brakes on that. And so that's another kind of immediate remedy, as many, there's heirs property rights that are being, possibly negotiated. And so that could possibly be, a wealth instrument for a family that still may have ties to that plot.
Thank you for those responses. Really so many good questions coming in. And I do, there was a request that these questions be answered and posted with all of the questions that are going to be answered and posted when we post the webinar, and we will certainly look into that. I understand that many people want to hear the answers to these questions as well. There are a few questions here about foundational policies, and are there foundational policies that support developing a structural racism declaration?
I guess I would say it's still early. A lot of these jurisdictions are still, as you've heard Zoe describe, trying to figure it out and try to figure out what they're doing. I would say, one of the places that a lot of jurisdictions are starting is just, do they have an office or position or budget allocation for this work? So one important first step, as we've heard kind of repeated, is you have to dedicate resources to the work if you want to get something meaningful done. And so I do think that's a foundational policy, is that you establish an office, you establish a budget, you have a director, you have a team dedicated to this work. And that the second piece would be strategic planning, really setting benchmarks and goals as part of that process, and then moving forward. I would say those are two important places to start.
And I would add to that, as some of the speakers have spoke to today, having a policy that requires the consideration of racial equity in your decision making, and that includes the application of a racial equity tool and making that a requirement across government and government agencies. I would say that that is another foundational policy.
And I would just jump in and say, Zoe mentioned this, and I wanted to highlight this for my presentation, that one of the racial equity tools that we looked at was from GARE, and their use of racial equity impact assessments. And so what I showed you from Portland was what they developed after working with GARE. But I think what is key to foundational declaration is that it's not just enough for these tools, for these impact assessments, is that if you look at communities that began using those, that they've actually operationalized it. So it's a part of government, it's a part of their hiring, it's a part of everything that they do. And so what I think is foundational is that you don't just stop at the office at the declaration, that it's written in there, we're going to evaluate, and how are we going to change our culture? How are we going to share power with others so that we can achieve racial equity, because we don't have all of the answers. And so I think looking at the work that Seattle and King County are doing, because they were sort of at the forefront of these processes, would be great in terms of moving forward.
I'd say another piece of way in which we have really been understanding the foundational aspects of it. There are kind of two documents. The first is the preamble of the Constitution. In these 56 words, we are hearing our charge about ensuring the health and well-being, right, and the prosperity. And I would encourage everyone to relook at those 56 words. I have a new ritual when I have the opportunity to begin certain meetings with stakeholders to remind them of the foundational charge. The second is Title VI. There's a great documentary called The Power to Heal. We worked to provide screenings of this for everyone who works in a federally funded program, to remember that in the Johnson administration is when we eliminated or worked towards eliminating desegregation in our healthcare systems, and that ultimately informs everything that we do for those that are working with, .gov, titles or funded entities. And so those are two ways in which I'd say two instruments that inform the foundational aspects of any plan that we are all here putting together at a local jurisdiction.
Thank you. We have about 1 minute left. I will ask just one last question to the panelists, and that is, what can community collaboratives do in this space?
Could you repeat that?
Sure. The question is, what specifically can community collaboratives do in this space?
Well, I'll start. One way our community collaborative was absolutely instrumental in us being able to acquire was the penning of op-eds that helped create the groundswell and ensure to our local elected officials that this is exactly where the community was, this is exactly where our local leadership is, and that there was a base to support this policy measure. Not only that, they also submitted handwritten letters to them directly in support of us declaring racism a public health crisis.
And I would just double click on the idea that Rukaya shared about developing a plan from the community. So I think community coalitions can come together and develop a set of priorities and preferred action items and action plans and present them at city council, get on the agenda, present them at a county commission or school board meeting, and really advocate for those community priorities. And I think, you don't have to wait for a government actor or agency to come in and help to facilitate that conversation, especially because we know that there's so much great infrastructure in communities, the faith community and school communities, et cetera, to facilitate those conversations and help people to kind of pull together their resources and share ideas in that way.
Unfortunately, it looks like we've come to the end of our time. It is 1:30. I just wanted to thank our panelists again. This was for sharing your expertise in this much needed conversation. I have seen throughout the chat that so much praise for what you've talked about today and what you shared with the audience. So I also want to thank the audience for participating and let everyone know that we will be posting a copy of the webinar on our website in the next few days, and you can get a copy there. And we will also be following up on any of these questions, so many questions that we weren't able to present to the panelists today. So thank you all.